Welcome, everyone. Thanks for joining me today for the Overpayments What You Need to Know webinar. Our goal is to focus on the overpayments process, and we want to answer as many questions that you have as we can. I'm Tom Ryan with Provider Outreach and Education, and I'll be your presenter. Today, I am joined by Leanne from my team. She gets to troubleshoot those questions that you have down in that chat. She's going to give you some resources and other things like that. I do want to remind you that we did put a disclaimer at the end of the presentation, and the disclaimer just basically is to remind you that this is for educational purposes only. The Medicare program can change. Now, that brings me to the first question, and I'm going to move on to my objective and agenda slide, which is slide 2, is what has changed? And the answer is nothing's really changed with overpayments, and nothing has changed with the process. However, we do have an issue going on and we want to address that as we get into it. And that's where the changes coming in is to make sure that you're getting us the information that we need to process your overpayment timely so that we don't start taking money back, then find out that we have the overpayment, then have to reissue you. Oh my gosh, so much went into that one statement. We'll get more into that, so don't be worried. But that's what's changed. It's just more of an informational or a learning session. I want to thank those of you that are new to Medicare. I did have quite a few of you say, hey, I'm new to Medicare. I'm just trying to learn. I need some basic information. And so I want to thank you for joining us. If at any time you feel like you're lost or you need help or you need some guidance, throw something into the chat, please. I want to make sure I don't lose you along the way. Then we get to a certain point and you have no idea what I'm talking about. That's not helpful to anyone. So we want to make sure we meet that. So with that, our objective is to help everyone understand the Medicare overpayment process, and that process is how we take money back that is owed to Medicare. So we will, again, on this, look at the process. We're going to talk about ways you can return the money. And so that's a big one right there. And then we're going to talk about disagreeing if you owe the money. I don't agree that I should have to do that. So please make sure that we are addressing the different areas that you want. Again, put any questions you have into the chat. We'll get to those at the end. So we're going to start with the process. And yes, I understand these are high level slides and that yes, this is basic information, but please remember, I do have quite a few new to Medicare people or people who ask for a basic review. So I need to start off there so that we can get into some of the other ones. At various points, you'll hear me say this is the question you asked in the slide that I built to address that. So some of these slides are actually built to address the questions that you asked during registration. So the process is really the base starting for understanding what we do and why we do overpayments. An overpayment is actually defined by the Department of Health and Human Services because the Center for Medicare and Medicaid Services is under that executive branch. So when the Department of Health and Human Services tells us that they consider an overpayment is anything exceeding regulation and statutorily properly paid amounts. This then leads to a debt which is owed to the federal government. For Medicare, that means that the Medicare program under the Centers for Medicare and Medicaid Services has given you additional funds for any reason. And we'll go through some of those reasons next. But whatever that reason is, whether we identify it or you identify it, an overpayment has occurred and you now owe us money. That's the debt that's owed. Very specifically, I want to thank the new person who asked this. They specifically asked and told me they were new to Medicare and then asked, I don't really even understand what would cause this. So let's get into that just a little bit here. Now, I want to let you know this is not an all-inclusive list. Remember, as I said, anytime Medicare is owed money, that's when the overpayment occurs. The overpayment is simply the asking for the money back, which you are required to pay. But what could cause this? Well, how about a processing or other administrative error? That can cause it. Sometimes our system does something that doesn't make sense to you, or sometimes when you submit, because of what you're submitting, it may give you additional information. Um, in which case, that additional information allows for additional payments, which is actually a processing or administrative error. There are times when something is incorrectly coded. So based on the documentation and during medical review, we're going to look to make sure that that code is the correct code. Lots of times we see that with evaluation and management services or those professional visits. There's also insufficient documentation. You billed us, but when we request the documentation or we look at it, we can't find what you're billing us for, or there's elements of the documentation that simply aren't there, such as a signature. Everything has to be signed for, but not only does it have to be signed for by the professional, it has to be signed for by the patient. So if we don't have that information, then we see insufficient documentation. There are policies put in place by CMS, the Centers for Medicare and Medicaid Services, and also by your contractors who process your claims, which are Medicare Administrative Contractors or MACs. These policies can lead to medical necessity errors. So they can create an overpayment in that you don't meet the medical necessity requirements in those policies. If it is a CMS policy, it is a national coverage determination. If it's a MAC policy, it is a local coverage determination. There are also services that are what are referred to as bundled. And CMS has a variety of different forms of bundling, so I don't want you to think, oh, it's just one type. Oh, we're done. There's one that is commonly referred to as procedure to procedure national correct coding initiative edits. That one says when you build this procedure, this other procedure is not payable for the same patient on the same data service to the same provider. They bundle together. There is also a physician fee schedule bundle, which says, hey, this service, no matter what you do with it, will be billed with or will be part of another payment. That's a type of bundling. There are also other types of bundlings which go into inpatient care first, then outpatient care. So let's say that the patient is in a hospital stay and somehow comes to you. Maybe they're checking something out, they're just on leave for a little bit from that hospital stay, something like that. That's a form of bundling. Another one is skilled nursing facility consolidated billing, which says the skilled nursing facility is responsible for that service. No, not all services. Some services are beyond the scope of a SNF, but that's a whole separate series of classes. So that's a type of bundling as well. We never want to forget hospice bundling and home health service bundling. Now, hospice bundling is simply related to the diagnosis, therefore, the hospice is responsible for paying it because the patient has elected to give up their medical care and is instead on comfort cares. That's hospice bundling. And again, home health says, I've elected to have certain services billed to a home health agency and they will monitor and activate all care within these certain services. And there's a procedure code section on the CMS website which would give you those. But it's again another form of bundling. We also then take all of these different types of reasons and we build automated edits. We try to keep as many things happening without a manual person touching it as possible. These automated edits can be triggered by both processing systems. For those of you that don't know what that means, it means that there are two processing systems for Medicare, and they are defined by how you bill. MCS, the multi-carrier system, MCS, is for 1500 bills or 837P electronic transactions. FIS, Physical Intermediary Standard System, sometimes referred to as shared, or FIS is the acronym, but you'll hear standard or shared. This system bills on UB04 or 837I. It is about the billing type, okay? And so each system then has automated edits. So sometimes it's important to make sure you understand which one you're asking about because that can cause an overpayment based on what needs to be done. So we'll talk more about some of those. Another huge reason is automated edits built under the coordination of benefits system, which is a different system, the COB system. And that system controls whether Medicare is the primary payer or whether there is another payer before Medicare. Many of you may have heard of this referred to as Medicare secondary payer or MSP, but that's another big reason for overpayments. The last one is what we encompass as eligibility issues. Now, this means the patient may not be eligible for Medicare at all. They don't have Part A or they don't have Part B, and that portion cannot pay for that service. It may mean that they've elected a different type of Medicare. It is still Medicare. It's just not traditional fee-for-service Medicare, and this is called Medicare Advantage plans or Part C plans. But it could also mean, under eligibility, that they are not deemed eligible by the Social Security Administration. Instead, they are deemed eligible by the Railroad Retirement Board, which goes to a different Medicare administrative contractor to process the claims. So there's a variety of reasons these can happen, and each one will trigger something within the system. So the automated edits and audits are what we use or try to use as often as possible. I will tell you medical necessity errors, these are reviewed by someone. That's why they're medical necessity errors or they're written within a policy. Starting the process. So there's two different ways that we really look at the starting the process. And the first one is Medicare starts the process. We discover an overpayment. Therefore, for whatever reason, we build an accounts receivable or an AR in Glass, which is our accounting system. It is the Health Integrated Accounting System, and I forgot what the G and L are in the middle, but it is an acronym. It is our accounting system. Okay. What happens when we do anything within this is it says, okay, did you find something going on? Then we're going to begin to build it. Well, what can be found to be going on? Well, the provider can find it, Medicare can find it, or the patient can find it. Again, once identified, it will be built. Now, the patient, they can pretty much write us anything they want, and we will take it and kind of do an investigation. And if we find an overpayment has occurred due to the patient's request, we can request money back. Providers, we do ask that you give us a form or that you request it in our portal, SNAP, Secure Net Access Portal, SNAP. And our portal is available on our website. We'll talk more about that. The basic way that it happens next, though, is someone has to build an accounts receivable or something does. There is audits and edits that actually build it without us touching it. So let's say that an inpatient claim comes in and it overrides the fact that we should have paid your outpatient claim. Remember that bundling that we talked about? Our system doesn't say someone's got to manually enter that. Instead, what it does is says, hey, take this money back. So the accounts receivable is automatically built. With that, a system generated letter is sent. So once the accounts receivable is manually or automated billed, then we send a letter. The letter explains what you owe, why you owe it, and your options. The providers then have to respond back to that letter. Sometimes they're expecting it. Sometimes they're like, hey, could you take this money back? We found an overpayment, we get it. However, other times they're not. It doesn't mean that you don't have to respond. So you can respond by saying, okay, here's the money. Awesome. You can respond by saying, hey, could you just start taking the money back for my next set of claims and we're good. As long as that's paid back in a reasonable time frame, you will not have interest. Or you could say, I really don't agree that I owe this money at all, and you could do an appeal. Now we'll talk more about the appeals process because there's 5 levels of that as well. Once all of that's done, if it is fully paid back in any way, shape, or form, we do then close the accounts receivable. So then you don't owe us anything anymore. We're done. We're good. That's what we ultimately want to have happen. Now, there are some ways in which during the time that if you disagree with that accounts receivable, we can set some stuff aside. And I'd like to go through some of those different options now. So we got the starting point. Someone has to identify it. But please don't get this confused, and this is why this slide was built with an automated identification. And the reason that we built this slide in is I had 4 questions that they were talking about the bundling process, and I'm assuming, well, they didn't use the word bundling. What they used was inpatient. Why is it suddenly coming back, taking my money back? So what happens is you, as someone who can bill on a 1500 or 837i, 837p, or outpatient services, you don't have set deadlines. You don't have to bill every 30 days, every 60 days. Now you say, oh, I do have a recurring service, so I do need to do that. That's okay, but it's not a requirement for all services. Okay. So what happens is you bill 6 days after. You do a weekly cycle. So it's 6 to 7 days after the service has been performed. You bill it, it comes in. We take 14 days to process it. We send you your payment. You're good. Well, then the facility bills on a 30-day cycle and they're billing to FIS. Remember, they bill on a UB04 or an 837I and it goes automatically into a different processing system. FIS then has 14 days to process a clean claim, but up to 30 to process it. They can get it done in 14, could take up to 30. One thing to keep in mind is I said clean claim. Well, what happens if it's audits, edits, all of that? Then it takes longer and longer. That's why it can be 60 days or 90 days. And the example that was given, the person said that they had had their payment for over 75 days. So they got paid, they got their money. Then the inpatient claim in, we got it processed, and all of a sudden we're sending an overpayment saying, no, this patient's inpatient. We did not know they were inpatient until that Part A claim initiated. Once that happens, this is not something that any person has to go in and say, hey, take money back, open this accounts receivable. The system is able to use the common working file or CWF to let the system know, and that's the high glass system, the accounting system, to trigger an overpayment. It can automatically be built and goes out without a person ever looking at it. So hopefully that is something you are aware of. A couple other systems will trigger an automated response from the common working file. And when you talk about CWF or the common working file, think of it as like a communications hub. That's the best way to describe it. It's what everything goes through to go back and forth. So both processing systems, the coordination of benefits system, the Medicare Advantage plans feed to the Social Security, but then they have a system that feeds into the common working file. So it's just this big communication hub. So if the coordination of benefits system gets updated, we can take back claims that should have been sent to primary insurance, or we can freeze processing, and then this will all be done automatically. It doesn't have anything to do with someone manually doing anything. Also, the MA eligibility system can come in and say, yes, you have Medicare eligibility, and we kept that the same as what's normal. But on top of that, you've elected, or not you, the patient elected to have a Medicare Advantage plan. By electing that, we stop traditional fee-for-service payments. So they're still eligible for it, but we're not going to pay under it. Instead, we have to go to the Medicare Advantage plan. These will all create automated responses. All of them will. So that's where those come from. And hopefully I did also get you the questions answered that you had. The one question that we did get was from someone who's just beginning to work with the patients as well. And they said, can a patient ask for an overpayment? And as I said, yes, they can. But we don't just automatically take an overpayment from a patient. And I'll give you a few examples. One common reason that we get for trying to get an overpayment started from the patient is that they never saw that provider. Well, do they see the person reading the x-ray? How about a test? They may not even know who that is, right? They may not know who the lab running the test is. So this is a completely foreign entity to them, and they may not be aware of it. So they're saying, hey, I never saw Dr. So and so, and I don't have any idea who this is. Well, yeah, you didn't see them. We know that. And yep, that type of service doesn't need you to see them. Instead, they're reading a radiology exam or something like that. So we do investigate before. A lot of times, patients will also report incorrect payment amounts. I'm not sure what they're trying to do with that, but we've seen patients say this was paid way too much, or this wasn't paid enough, or this is, and we will ask for medical records to look and review that amount. However, the fee schedules are set by CMS. It's not like it's something for the most part that we get involved with. So, okay. Also, some patients will report services were not provided. So you got a bill, but it wasn't me. Okay, so then we go back and investigate it and we find out they're right. It was the wrong date of birth on that person, so therefore it was this person. So we will take the money back and have the provider bill the correct claim. So it can happen for a variety of different reasons. But please remember that with this one, once the patient starts an identification, it's very, very common for us to request some form of medical records. And if you don't respond, that will equal an automatic takeback or an automatic overpayment. You have to respond when asked. Contractor identified. We were asked just for some medical review contractors that can identify this. The person that asked specifically asked about the Medicare administrative contractor. What they used was WPS, and that's us. We are your Medicare administrative contractor. So we're the first ones listed. Now we do identify overpayments. We identify it through the targeted probe and educate process. That's one way in which we do medical review, and what we're doing is actually looking at the medical records to make sure everything meets up. This is a minimum of an RN and could be up to the MD or a different specialist, just depending on who's looking and what they need to review. Okay, so that can definitely identify an overpayment. We also take the first step in an appeal, which can involve medical review. So we say it's not medically necessary. You send in additional documentation or documentation highlighting why it's medically necessary and why you feel that way. That first level of appeal, which is a reconsideration, or I'm sorry, a redetermination of the original determination. Okay, so we'll do that. Then we're going to move on just briefly, and I'm going to skip down a few, and you'll see QIC, or the Qualified Independent Contractor. They're another contractor, but they work with appeals as well, and they do the reconsideration of the redetermination of the original termination, otherwise known as a level 2 appeal. And they're going to look at the same thing that we are, unless you send in something additional to them. Okay. So that they're going to work the same as the MAC. Now, there is also a RAC, or Recovery Audit Contractor, and their job is to look at post-pay medical review and can definitely cause overpayments. If they find an error for any reason, you will receive an overpayment, and then you have to go through the processes with them. Okay. I was asked about the CERT contractor, CERT, which is the Comprehensive Error Rate Testing Contractor. And if you notice, that is listed on the bottom of this one, of this slide. And the reason that it is their job is to look at paid claims and to determine whether they were paid correctly. So while they can cause an overpayment, that's not their primary focus. Their primary focus is to say, hey, was this claim paid correctly based on the documentation? So if a claim is adjudicated or paid, they'll look at it. I was also asked about two other ones, so I thought I'd put them right on here. And one is the SMRC. I like to call this the Special Projects Medicare, or Special Projects Contractor. What CMS does is assigns them a topic and says, hey, for this topic, request medical records. That's why they're the Supplemental Medical Review Contractor. Okay, and then the last one is the Quality Improvement, I'm sorry, is the UPIC, the Unified Program Integrity Contractor, or UPIC. Now the UPIC is a little different. They investigate fraud, waste, and abuse situations. So if the patient reports that they didn't see you as a provider, but then they go on to say, wait a minute, and we go on to say, wait, we did that investigation and you're right, they didn't. Then here's 6 other ones that, oh, wait, now we may refer to the UPIC to actually investigate that out further for fraud, waste, and abuse. Okay. A little bit different situation there. Most of you will probably never deal with the UPIC if you are never under a fraud, waste, or abuse investigation. We actually have found that for the most part, our providers, they don't hit within that a lot. So hopefully that answers the questions about contractor identified. One thing I did want to point out is that if you ever have a question on whether or not someone is a contractor or a review entity, please take a look at this interactive map. There's a quick link right here on the bottom. If you select it, it will open the CMS website to that map. And the map will just allow you to pick your state and then tell you who the contractors are within your state. So I'll just pick Iowa because Iowa is within our jurisdiction, J5, and then it'll go through and tell you who everyone is. Okay. Just a great opportunity if you ever have a resource or you're not sure. You can also give Medicare a call and we will help you understand who they are or if they should not be someone that you're working with. All right. There are times when a provider will identify an overpayment. I gave you an example earlier where you actually hear that, okay, we found out that this patient isn't the right patient by date of birth, but it was the right name. Sometimes providers will find that too, and they'll be like, what do I do? That's incorrect billing as an overpayment. So what you want to do is, again, bill correctly, right? Get it right, get it in the file, get it in the system, and get it processing. But you do have to file or ask us to take that money back, or you can simply send the money back. And I want to show you a couple of forms that go with that after we finish up on this slide before we get too far into this. A lot of providers will find primary payer information, whether it was reported or not reported correctly or other things like that. So you want to make sure that gets reported. Medicare Advantage plans, this is another one. Providers will bill us and they'll deny for Medicare Advantage because they have it on file, but then the patient gets a take back something. They get rid of their Advantage plan. The system gets updated. Providers have to rebill it. Could also work the opposite. The Advantage plan could be on file, get removed, get put back on, and then again get removed. So it can kind of go back and forth based on that information. Okay. So a provider can actually request an accounts payable be open, and that would automatically trigger an overpayment letter to be sent to them. They can also return money that they found. CMS does always recommend that if you found money, just simply return it. Before I go too far, I do want to just remind everyone a couple of things about that. So first, let's jump to our website. And again, Leanne, can you verify that the website's did open?
The website did open, Tom.
Perfect. So if you're learning more about overpayment and you want to request money, that we take money back, or you want to give us money back, one of the ways to learn about it is to simply come to the topic center and go down to overpayments. This will walk you through all of these different things that I'm going to do. On this area, I want to point out this green bar, and there are 4 items: guides and resources, which is everything here, news and updates, FAQs and forms. Feel free to read and search through those. If we go to forms, what we do is we see a bunch of different items. Now, these items can change depending on the line of business you are in. That is up at the top. So choose your jurisdiction equals choose your Medicare line of business. Jurisdiction 5 has 2 parts. Part A, FIS, Part B, MCS. Part A, Iowa, Kansas, Missouri, Nebraska, and our national contract providers. Part B, Iowa, Kansas, Missouri, Nebraska. So if you're billing a UBO4 or an 837I, you are under the line of business Part A. If you're billing a 1500 or 837 P, you're under the line of business Part B. Indiana and Michigan is J8, and the actual billing types work exactly the same. But why is this so important? Because we get some of these coming in, and if you notice, there is one down here, overpayment notification and refund form. Now you can do this online in our portal much easier than doing this paper one, but I want to show you this one, and I'll highlight what's wrong and why we're doing the education. So as we read through, we find out, yep, it's going to be a form, and it says we actually encourage you to go through the portal. I'll talk about that in a little bit. Talks about the form and everything you have to know. Then as we go down, it will bring up this area on the page, which is actually how to complete the form. This is where we have a problem right here. These 3 fields. So let me download that form with this explanation, and I'll tell you what the problem is. If you do not select the correct contract or the correct type by line of business, not type of service, line of business, UBO4, 837I, CMS 1500, 837P, and are you in Iowa, Kansas, Missouri, Nebraska, or the national providers, or are you in Indiana and Michigan? Okay. Then tell us the state that it processed in. All of these are key to make sure that your overpayment comes in, whether it's a request or a refund, doesn't matter, because notice the refund is right here on the request form. Or you can leave that blank and say, hey, I want you to take money back and here's why. We'll do that too. If this is not filled out correctly, this is causing issues for many people on the 1500 and the 837P side. And what's happening is we're taking money back because we didn't get this process to the correct jurisdiction with the correct area. And then all of a sudden we get this in and we're like, oh man, we got the money already. Now we reapply it, but now we have to reissue all those takebacks. And so a take back begins at 45 days. If you haven't paid it in full, then all the other claims will offset to take back the money. So it is very important that you get this done correctly. Now, as I said, the other way to do it is simply come into the portal user manual right here in the top. I can't actually enter the portal, and I can't enter because it has PHI and PII, so I can't do anything like that. Okay. Then we scroll down and you're looking under this area. I just got to get down far enough, so look away if you hate this. I apologize for that. It takes me a second. If you go under transactions, here's your overpayment claim adjustment, and that'll just kind of help you understand. If you go down under finance, this is where you give us money back. So while we have one form that does both, here it's give us money back or ask for an overpayment claim adjustment. Okay. So if you've identified an overpayment and you need to give us money back, yes, you need to fill out that form or you need to do the claim adjustment. It's just, do you give us the refund section or the claim adjustment? Now on the form, what's nice is it's one form. It's just got an extra section. I just want to again point that out. When you look at the form, scroll down, it's all one form. Okay. It's all one form. So if you're giving us an overpayment or you're giving us a refund, so you're saying, hey, we owe you money or here's the money. The difference is this part down here, whether or not the check is attached. So hopefully that makes sense. Hopefully I got all those different little components. I know that's where the issues are currently coming in and why some people are actually on here. And I had quite a few questions, so I did not want to skip that at all. All right. Somebody asked me, is there other people that can identify overpayments? And the answer is absolutely yes, yes, yes. The other people are federal entities. So if you have not heard of the Office of Inspector General, they can identify an overpayment, and once identified, we are required to take it back. What they do is they identify potential risks to the Medicare trust fund. They're kind of, I don't even know really, except other than to call maybe a legal watchdog, they're kind of making sure everything should be paid, that should, in that we're not having, an overall risk statistically a bigger issue going on. So they may find one for you and it's just one, or they may find across the board hundreds in which they say, hey, there's a big risk for this. So it's the Office of Inspector General. Somebody did ask me about the Federal Bureau of Investigation. They are part of the fraud, waste, and abuse investigations. So a UPIC would refer to the Federal Bureau of Investigation as a potentiality. The FBI has a healthcare fraud area. They would then investigate that. So it all works together. The Department of Health and Human Services always can do it. It's their program. They're the department in the executive branch that does this. So it's their program. If they tell us to take it back, yep. As a matter of fact, they actually have a level 4 Department of Appeals board, which is part of them. Okay. Then you also have the CMS, which is the Center for Medicare and Medicaid Services. It is their administration of the Department of Health and Human Service program. So they are the administrator, the department that administers it. Or I'm sorry, the center that administers it. They do a level 3 appeal. So they will also get involved. And then last, you actually have a different complete area, and it's the judicial review, which is a level 5 appeal. So depending on what level of appeal you're at, you could be working with a contractor or with a federal entity. Okay. One question that was asked, and I just wanted to address that at this point because we're getting into the different levels. New documentation is accepted at level 1 and 2, level 3, 4, and 5. If you have not provided the documentation previously on an appeal, then you must explain why you did not and were not able to provide it previously, and the reviewer entity, whether it's the CMS, Department of Health and Human Services, or the judicial review has the right to accept it or not. So I wanted, hopefully that answers your question. So it can affect an overpayment in that if it doesn't, yes. So, all right, let's talk a little bit about what's called a demand letter. This is how we tell you that you get to give us an overpayment. So can you initiate us sending you a demand letter? Yes. If you fill out that form that I just talked about and you don't attach a payment, we're going to issue you a demand letter. If you attach a payment, we're not going to issue you a demand letter because we have the payment and we're going to go ahead and close it. So yes, you can fill out the overpayment request form and not attach a payment, in which case we move on to the recoupment and the demand letters. Hopefully that makes sense. Okay, so if you identify it, yes, you need to tell Medicare you can or cannot send the money back right away. If you don't, we do send you a demand letter. The demand letter then explains why, the amount that's due, and the calculation of that amount. It will also explain your interest rates and applications, your rights and obligations, such as you can file an appeal and what that means, and any claims that are affected by patient information and dates of service. So it just basically says, give me the money, and that's what we're looking for. If you're looking for more information on the demand letter and the information that you're going to look at, I would recommend coming right down here. This is our debt collection area that we have to follow to get you guys that information. There is also a resource on the CMS website. It's a Medicare Learning Network booklet. It's going to have overpayments. I'm going to show it to you in just a moment, which is why I'm bringing it up. And it'll actually walk you through the steps. So I want to show that to you in just a moment after we get through a couple more things here. Provider actions. Well, as I said, you can pay it. You can say, hey, take the money back, and that's an immediate offset. You can do an appeal. Right? Those are all actions you can take, and we've talked about those. If you disagree, it is through the appeals process. Okay. If the AR or if the full amount is offset or taken back, so whether you give us the money back, whether it goes to offset, however, it is just closed. If it's not done in 90 days, though, there are further issues that can happen, or 45 days, there are further issues that can happen, and that's what we really want to focus on next. So I wanted to bring that up. One thing I want to remind you is that if you do disagree with an overpayment and you don't want us to start taking the money back right away, and you are choosing to file an appeal, if you choose to do that within 30 days for the level one, we will not begin to take the money back until after a decision is made. So typically it would start on day 41, but we'll wait until after a decision is made because the appeal does affect that. Now, I do want to remind you, you can pay it back and still do an appeal, and you have 120 days to file that overpayment redetermination, and that's perfectly fine. However, if you do not want us to take the money back, you want to make sure you get it filed within 30 days. And that's why it's a couple of different places on there. Okay. A little bit about returning the money. Before I get too far into this, what I would like to do is walk you through a chart. I think it's very helpful. The chart is actually on the CMS website, so I'm going to jump over to that booklet. How I find it without having to, jump around or do anything too much, I like to type, or if I could spell, that would be helpful. Overpayment. Now, I didn't put a T on it. That's okay. It'll bring us down through a variety of different things. Let's put the T on there and see if that brings up what I'm looking for. Medicare. This just talks about returning and self-identified, which is one of the areas that we have talked about. Um, and if we scroll down, you're going to see this 2025 and you'll see MLNC. This is what we want to look at. This is the booklet. So if we open it up, oh, no, that's an update to the booklets. We can do it this way too. Go to training and resources. This is the long step. Medicare Learning Network, resources and training. Scroll down, you're going to look for a resource, a publication, and multimedia. When you get in, you can filter for, overpayment. This is what I'm looking for. It's a fact sheet. And if I scroll down, I can actually open this up. It's great. The page that I really like, sorry, I didn't quite get down far enough, is page 7. This is that chart that I was talking about. Now, this is what's going to cover the last, those two slides. So it's going to cover slide 15 and 16 together. So here's where we send out. Okay, we find out, yep, we have 7 days. The last day you can submit a rebuttal. For those of you that don't know what a rebuttal is, it's simply a statement saying, hey, I don't intend to pay you back, and here's why. We can look at the overpayment and make a decision. It's not part of the appeals process, though. On day 16, if you ask us to, we can start an immediate recoupment, which means we can start offsetting your claims. Then again, you can read through all the different stuff. I don't want to read through everything for you, but want to show you that on day 31, this is the first day that interest can occur. So if it's not fully paid here, interest will occur. Even if you file for an appeal within 30 days, we can still apply interest if we uphold the overpayment. Okay. Continuing to scroll down, again, you can read through any of this that you want. And I just want to point out the MAC attempts to call you and begins to look at a referral to the U.S. Treasury if it's not paid back. Here's your last day to file it. And the reason that we do have 120 days before we refer to the Treasury is because if 126 days, I apologize, is because if you have 120 days to file an appeal, we got to make sure you didn't file an appeal before we refer you on. So, but again, it's just a great quick little chart, help you through that process. Again, this is slide 15 and 16. All of that's also spelled out for you, but I just want to remind you to come back up and it'll talk about all the different items that you may want to know, just including, all the stuff that I've given you. All right. One caution that someone asked me about is they said they're having trouble with their appeals, and I do want to just address that real quick. The reason that you're having trouble with it, you said, is because you're saying, "Hey, I'm appealing the claim decision." You're not appealing a claim decision, you're appealing an overpayment. So it's two different things. I want to remind you that the refund, the best option, the best way to track it, get through it, is to complete the electronic version. I did show you that. The paper version is an option, and that is to complete the form. With the paper version, you can send a check. You don't have to, but you can. With the electronic version, please make sure you're using the appropriate feature, either the OCA or the refund feature if you want to send money back. Okay. We can do an immediate offset, and that just simply says, hey, starting on day 16, start taking my payments to pay this back in full. That's fine. It can be one time for that one overpayment, but it could also be set up to be forever until you revoke it. Okay. You could also just wait and let the offset occur. That becomes risky for a lot of people, though, and it's not an action we really do recommend. So that answers the questions of how you can pay it back. Hopefully that all works for you. Slide 18. Extended repayment schedules. We have someone that asked, and I'm not sure how big their overpayment is, but they basically said we can't afford to repay it. It's not that we don't disagree that we owe it. We just know that right now, if we did repay it, it would cause us financial hardship. So that is an understandable thing for Medicare. Medicare says, yes, we recognize that. Here's what we need you to do, though. We need you to file for an ERS, extended repayment schedule. And it says, hey, I can't make that 30 days, but I can look at how I'm going to repay you, and I'm going to tell you what I'm going to do to repay you, whether it's $30 every month for the next how many months, whatever you're doing there. If you go with a 36-month or less repayment schedule, we can approve that without going to CMS. If you go above 36 months, it has to be approved by CMS. You do have to issue us a letter, and that letter must also then give the first payment. But keep in mind, because you're going above the 30 days, interest will apply until this is paid in full. Okay. Now, if you do happen to need to do that, please come back to our website, wpsgha.com. I'm in that forms view, and that was in the topic center under overpayments and then the word forms. Please make sure that you follow the extended repayment schedule information right here. It will walk you through what needs to be there. It's going to give you a checklist. just make sure that you're not missing anything. This can cause some other issues to happen. So I want everyone to be aware of where that is. Somebody asked about that immediate offset or immediate recoupment. That's this one, and that's the one that says start taking it on day 16. Okay. Hopefully that makes sense to everyone. Oh, well, I just went over the booklet. Here's a link to that booklet that I was just showing you. Oops, I clicked on it. It's going to open. I'm sorry, I didn't mean to open it. But the reason that I bring you to this fact sheet, the reason that I bring you here is that this right here tells us the date that it was published. This page will always have the most current version, and you can always download that from a PDF version. Now, if you say to me, oh man, Tom, I really don't remember how you got there. Again, I went to training and education, not Medicare, training and education. Then I went to Medicare Learning Network, resources and training, scroll down, resources and training, so I can go to publication and multimedia. And then I filtered for overpayment, and that's how I got to the booklet. It's the same page as I gave you on the landing page, and there's the booklet for you. So hopefully that kind of helps you out there. Also want to remind everybody that there's different resources that are available to you to help you if you need that. So these two are the financial management manuals. They're the day-to-day operating instructions that we have to follow. So the Medicare financial management manuals, and you can see chapter 3 is all about overpayment and chapter 4 is all about debt collection. If you disagree, what do? We talked a little bit about this again as we went through the time frame. A rebuttal is a letter just explaining why the max should not recoup. We will look at the letter. We'll see if it meets what we need to. It doesn't supply any kind of documentation or anything, so sometimes it's not always possible to disagree or to change from there. I will let you know it is not part of the appeals process and you do not need to do it. You can then look at if the RAC, remember that recovery audit contractor says, hey, you owe us money, you can actually do a discussion with them. And if you disagree with their findings, you have 30 days from the finding letter to ask them to do a discussion, and they can look at the information and the evidence to see whether they agree. This does not affect your appeal rights. They have not even transmitted us the information that you owe us money yet. This all occurs from a letter they send you, and that's where that 30 days from the finding letter comes in place. So if you want to learn more about that, feel free to drop down and see that. Oops. Overpayment appeal, we did talk about this. It's the same 5 levels. If you look at this booklet that's down here, I noticed in the Medicare appeals process, if you look at it, it has a really nice chart laid out for you. I've already gone through most of it, so I'm not gonna go too far into that. Someone did ask about filing the appeals. Again, this is that 30-day. If you file it within 30 days, we will not automatically start the recoup. Which brings us to the questions and answers. Again, I talked about a lot of stuff and got a lot of different things in there, so I'll go ahead and go through the pre-submitted questions, and then we'll take the chat questions. So, number 1. What's the best way to address an overpayment and request a recoup? The best way is to use our portal if it is a WPS issue, okay? When primary insurance pays, Medicare should only allow the difference between the primary payment and the Medicare allowed amount, correct? I was recently advised that we should accept whoever pays more, even if the patient has commercial insurance primary. We have recently submitted several overpayment notices where Medicare shows they processed as secondary, but they're still paying in full. So first of all, Medicare uses a formula, and the formula has 3 different components. So yes, there are times when Medicare will pay more than our allowed amount. Here's what we're doing. We're paying up to a certain amount, not allowing you to charge the patient. So if you, between Medicare and the primary insurance, get more money than the Medicare allowed amount, keep it. It's yours. You are legally entitled to do that through the Medicare primary payer formula. That's why we're giving it to you. Okay? Keep it. It's not wrong. The thing that you can't do is if you've gotten more than the Medicare allowed amount, don't bill the patient for anything. So hopefully that makes sense. Next question. What to do with credits that are over the file limit? If you do have that, you can do one of 2 things. Your cost report is one. You could also And that's for UB 837I bill, or you have that annual cost report that you file. You don't have to necessarily, I'm sorry, quarterly cost report. You don't necessarily have to file them if you don't have anything to put on there. The other way to do that is to use the form. So if it's not on the system and you're like, ah, man, I found it now, what do I do with it? Use that form that I showed you. Let it go through the system that way. So there are times when you do have to use the form. Okay. What if it's not a valid reason Medicare thinks it's an overpayment? And I'm not really sure what you mean by a valid reason that Medicare thinks it's an overpayment. So, not really sure where to go with that one. Um, if we've identified it and we're asking for money back, it's a valid reason. If you've identified it, you can return the money using the form or with our system. Either way, and our system is Snap. So, how to work an overpayment on a CMS claim? Um, I'm not really sure what we were talking about because this whole process is all about that. But always remember one, you're going to get a letter. Read the letter. See if you agree with it. If you don't agree with it, then file the appeal. The appeal is an overpayment appeal, not a claims appeal. Okay. I'm not sure what else to give you for guidance there. How to confirm a recoupment has been complete. Check our Snap portal. Check for the overpayment search feature. You can actually look at it. What are audits we can do to minimize overpayments or risks surrounding overpayments? Start with Medicare secondary payer audits. This is one of our highest denials, so we always recommend that you have those in place. Two, look for primary situations where there is an inpatient claim. In other words, skilled nursing facility, hospital, anything. Okay. Also, look for eligibility. Now that seems very basic, but remember, someone could have Medicare Part A, Medicare Part B, or both. So they could have one or the other or both. They could also have a Medicare Advantage plan. So there's a variety of things that happen, and that is actually one of our highest denial rates and causing overpayments to auto trigger, not any manual trigger, but do that. All right. That is the end of the pre-submitted questions. I need to go to Leanne, and Leanne, if you have anything for me, let me know.
Tom, we have a couple that you haven't discussed yet. First one is if I identified an overpayment and need to notify WPS, would I still fill out an overpayment notification refund form?
Oh yeah, yeah, definitely. So there's two parts to that answer. One, the form works great. Yes, it is that overpayment notification refund form. The other part that you could do is to come into the portal user manual, scroll through this. You can download the full manual or just scroll down. Again, look away because I'm going to scroll fast. When you scroll down, what you're looking for is this under claims, the OCA, overpayment claim adjustment. This means you're not giving us money. If you are giving us money, then you need to go to finance and do refunds. And if you open any of these, it will walk you step by step. Okay, you're going to do this. Now I need you to do here. Now I need you to tell me about it. Here's the different fields you have to complete, and here's whether we accepted it. Same thing, the refunds will actually walk you through step by step. Put the plus sign, go down, tell me who it's for. It's going to give you all of those key components. So I really do recommend using this. Okay, Leanne, sorry, next question.
No worries. Next question is we have submitted this overpayment identified form, but Medicare never recoups the money. When I have followed up on it, they state the dollar amount is too small to recoup.
Hmm. That's very possible. So there is a set dollar amount within the financial limitations manual, and it just jumped right off of my head. So if you go out, it'll actually tell you the dollar amount within that manual on what we can and cannot recoup. And the reason for that is sometimes it's more costly to take the money back. Now you can always build um, under the debt collection area. So if you can always build to that dollar amount, so you could submit like things. So if you have 8 of them, 9 of them, 20 of them, whatever the situation is, you can go back and build those together if you need to balance your books. So this is where we're looking at here. Nope. Sorry, I'm like, it's not opening. And then you can read through all of this, and inside here, it'll tell you exactly how much it has to be. And I don't know that exact section, so I apologize for that. We'll move on to the next question.
The next question that we haven't touched on is why would you choose to get a demand letter versus just sending the money back if you find an overpayment?
Oh, so that's actually a great question. And CMS would prefer that you just send the money back. However, some businesses require there to be a letter to send the money back, and it's a requirement that they've made as a business decision because it's easier for them that way, and it's their process or their flow. So again, totally your decision, right? No one's saying right or wrong to send the money back or right or wrong to get a demand letter. What we're saying is when you look at your business decision, that's what you have to decide. Next question.
Next question is can you go over the electronic way to do an overpayment? I think you touched on that just a little bit.
Oh, kind of. Yeah. So again, let me go back to this portal user manual. Here's where you're going to request it. If you're actually going to do electronic refunds on the electronic overpayment, I need you to scroll down until you find the finance section and go through the refunds. What you need to do then is start in and you'll see little cards. One will be labeled finance and you'll have a little plus sign. This means that you need to tell us about it. You then, as a user, you have to select who you represent today. Um, I will let you know, you guys, I'm going to keep going real quick. I should only have a couple more questions, so I apologize. I know we're right at 2 o'clock, so I just want to keep going through this. So you're going to pick your service NPI, tax ID. It's going to validate all of that. Then it's going to move down and it's going to say, hey, tell us where we should get the money from. That's the bank. And then you can go through whether it's depending on did Medicare request the refund, yes or no. If you say no, this is you refunding it. If you say yes, this is because we sent you a letter. Again, if you did say yes, it'll ask you for some information. If you say no, it's not going to do that. And then it's going to say, okay, what's the reason for the voluntary refund? And then you fill in information. Okay. So then it'll tell you, is this refund MSP or non-MSP? Remember, this is when there's a primary payer. This is when there's not, but it's for some other reason. We do this because we do have to track back and forth a little bit. Then you want to hit submit, and it's going to tell you whether it was successfully taken or not. If you want to then look it up, then you go to refunds, but don't go to the plus sign, go to the button, the actual big button for refunds, and it'll walk you through how to search to make sure everything is closed or good or whatever the situation is. So that's how you would do that. Again, using that portal user manual, I really do encourage you to do that. All right, Leanne, next question.
Tom, that's all for the questions that haven't been answered in the chat.
Perfect. All right, well, then that brings us to the closing. Sorry, that brings us back to me catching up to the slides that we were on. I will encourage you to take a survey. The survey gives us feedback. It's five simple questions. It's four simple questions, then another one that says, would you like to give us more? But it gives us the feedback. It helps us understand what you're looking for. You can grade WPS as a whole and myself for this education. So really take the survey. I really do appreciate that. A couple of options you have. There'll be a link put into the chat for you to use right now. When I close the event, you'll be given a pop-up box. It looks like this one on the upper right. If not, if you happen to be reviewing this and you find it on YouTube, go ahead and grab the Encore presentation survey, and that's going to look like the lower one. All right. Um, Couple of things I just want you to be aware of. I'm going to take questions, comments, whatever for the next 7 days. You can do that by emailing us. And again, that's wps.gha.education@wpsic.com. All I ask is that you put Overpayments webinar into the subject line. If you need contact hours translate to CEUs from governing bodies, and you only dialed in, please feel free to give me a full 10-digit number. If you did not dial in, you will receive a certificate from our automated system. It's going to come out in an automated email, and it's on the bottom of that follow-up email. So you'll automatically have that. If I do not have a phone number, I can't check the system to verify you were here. That's why we ask for a 10-digit phone number. All right, everybody. That brings me to the end of everything. Again, please remember, Leanne and I would love to hear from you. We'd love to have your thoughts and your opinions. So please feel free to do that. With that said, you may now disconnect. Thanks for attending and have a great day, everyone.